Mary Kathleen Wagner. So take your place at the table, please. Introduce yourself for the committee and proceed.
Mary Kathleen Green Waldner from Conway. Written within the government health care bill includes mandated public-funded abortions. 35 years ago, I took a roommate of mine to get an abortion. She asked me. I thought I would lose her friendship.
Ms. Wagner,
yes.
If you would, please keep your testimony confined to the nature of 1053, not the health care bill itself.
Well, within the health care bill, that this stipulates I pay for with my taxpayer money. That means I am paying for abortions. So it's all the same to me.
Ms. Walden, I truthfully respect that, but the bill, the nature of the bill has to do with the mandate that provides individuals and corporations from purchasing insurance. So if you would, keep your testimony to that, please.
Okay, I'll just simply state, it is my constitutional right not to be forced to pay for something that's immoral to me, a public citizen. This is immoral and it's unconstitutional. Every citizen should be able to have the right to say, no, I don't want to pay for this. I don't like this health care bill. Not every federal law is right. There are bad bills. And it makes no sense to me, just because something comes down the pike from Washington, D.C., to say we have to condone it. That's bad. That's bad law. That just doesn't make sense. You are here to represent the people of the good state of Arkansas. 70% of us do not want government-funded health care. So I ask you, I request, I plead with you, on behalf of unborn children, please do not make me pay for something that's immoral to me. Please allow this to go through committee so it can be voted on. Thank you.
Thank you, Madam Chair. Bo, can you tell me, I represent a rural part of the state, what will this bill actually cost the rural hospitals, or can you give me a figure if this bill should pass? I mean, if we should allow this bill to go into law, what will the impact be on the rural hospitals in South Arkansas?
I don't know that I can give you a monetary impact on that, but I could say that the more people that are insured that come through the doors of the hospital, the more coverage they have, the more the hospitals are reimbursed. As I said, uninsured costs, uncompensated care has risen to $382 million in cost, and that's significant. You spread that amount around to all the hospitals in the state, you've certainly got significant amounts there.
Thank you. Thank you, Madam Chair. Thank you.
Representative King.
Thank you, Madam. Thank you, Madam Chair. You mentioned in your comments that Medicaid reimbursement rates were below the actual cost for hospitals. Is that correct?
Yes, sir. At or below cost.
At or below cost. Who determines those rates? The reimbursement rates?
Well, the Medicaid division, and
But who ultimately decides that?
I guess it would be you to appropriate the money.
That's correct. So what you're saying is that, and I agree with you that, the unrecoverable costs are a big problem, because basically the people that pay their health care bills are paying for the people that don't pay their health care bills. That's correct. So I guess we just disagree on the solutions. On one side, you say you actually support the health care bill that has been passed in Washington, D.C. That's correct?
Our American Hospital Association did support it, yes.
So, but on the other hand, you're complaining about the government reimbursement rates. I mean, this bill empowers government more in health care and the reimbursement rates, but then on one hand, you're complaining about the government that they're not reimbursing you at the rates that you feel like that cost.
Well, the difference, as I understand it, that the commercial insurance market would be insuring those newly insured that come online, and Medicare and Medicaid is a different option.
But this bill is about empowering government more in healthcare decisions, basically. I mean, I would, the reason was against the healthcare, because I think that private individuals, such as banning cross state lines, groups like that there are other solutions out there that could be better than empowering government.
I guess the bottom line response to that is hospitals need more people insured because our uncompensated care costs have gone through the roof.
Catastrophic care. Get catastrophic insurance.
All right, seeing no further questions, we'll go to